Hi everybody, welcome to Community Corner with Assisted Living Locators. We wanted to do something a little different today. If you've all been watching lately, you've seen that we've done some pretty cool videos with some great people.
We're kind of blessed to have some really cool friends that know a lot about senior services all around the state of New Hampshire, and we're willing to take a few minutes to talk with Kristy and I. So thank you to everybody that's been on our little show so far, and thank you to everybody that's going to be on it as we move forward.
Absolutely. Today we just wanted to do something with the two of us, kind of talk about something that's really important that's going on in our state and obviously throughout the country right now. And the topic that we want to touch on is how dementia is a contributing factor to COVID, especially in nursing homes and communities. So we just want to talk a little bit about that today.
Absolutely. And Kristy and I want to start off with being completely specifically clear. We do not speak on behalf of any community, organization, employee, family, contact client, or anyone else in the state of New Hampshire. There have obviously been some outbreaks of COVID in some care facilities in the state of New Hampshire and at home in other settings. We do not speak on behalf of any organization in the state of New Hampshire other than Glen and Kristy Badger. But we're kind of uniquely situated in that we, through our training in dementia certification, through our franchise, through working with families for the last year and a half with cognitive abilities, and just with contacting with different in-homes properties and everything else across the state of New Hampshire, it's important to Kristy and I that we sort of come out on behalf of those organizations in general. And again, no specific organization, no specific details, but just to touch a little bit on these outbreaks. We hear in the news, it seems like once a week right now, that some skilled nursing facility or nursing home in the state of New Hampshire has had this massive COVID outbreak with these many infected staff and residents and these many deaths. And really, the numbers that we're hearing are staggering and horrifying. One community lost 5 souls over the span of a weekend. So what we are also noticing is not every outbreak is being reported in the news. Some communities are being vilified for having an outbreak. Outbreaks are happening in communities that don't lack for resources or skill or knowledge. It's really been interesting, might not be the right word to use over the last couple of months that this has been happening, but there's been some unique things that we wanted to touch on a little bit. So I think that there's a couple of important things we want to touch on first of all, and the first thing is something that we've talked a little bit about before, and we won't get into too much detail. There are different levels and types of assisted living in the state of New Hampshire and in general. So traditionally, most folks leave their home downsized, they move into an independent living situation as they require more supports with their activities of daily living. So bathing, grooming, dressing, medication reminders. They might transition into an assisted living sort of environment, or even bring some supports into their independent living to help offset that. Folks with a higher acuity, higher need for medical care, and unfortunately for a lot of folks with cognitive issues and limited resources, there are skilled nursing facilities, nursing homes, or if you grew up in the state of New Hampshire like we did, county farms. So nursing homes, skilled nursing facilities are one level of care, and it's important for folks to understand, I think in general, that those skilled nursing facilities have a couple of things working against them. So first of all, they are by design set up to take care of the highest acuity levels of individuals. So folks with underlying medical conditions, comorbidities, I always screw that word up, I'm not a nurse, but really folks that need a lot of supports medically, clinically to get through their day. Those are folks with lots of underlying medical conditions. And in a lot of instances, again, those are folks with some sort of cognitive abilities. So those nursing homes, and even what we're seeing in some of the lower levels of communities that have had some issues as well, COVID really spreads extremely quickly through these communities. And kudos to the communities that have been through this and that are going through this. We can't even imagine what it's like to deal with this. You're charged with taking care of a human being, and you're doing everything that you can, and there's no solution for it. So I think it's important for a lot of people to understand some of the underlying factors there as well. So again, looking at these nursing homes, the skilled nursing facilities, These are the folks that in our state have the highest level of need. Generally folks that are in their 80s and 90s, although there are some folks in their 40s and 50s. Folks with some serious underlying medical conditions, whether they're respiratory in nature or not. Obviously, people are not in skilled nursing facilities because they don't require nursing staff. The other big challenge that we just wanted to touch on a little bit is cognitive impairment. So it doesn't matter whether it is a skilled nursing facility or someone still in their home with cognitive issues or any of the continuum in between. We just touched on this a little bit with Melissa Greenier from the Alzheimer's Association as well. Folks with cognitive issues simply do not understand the need for these social protections that we're putting into place. So things like social distancing, you can't explain to somebody with Alzheimer's that thinks it's the 1950s that they need to socially distance from someone. They simply don't have the cognitive ability to be able to process that. There's some other challenges as well with our new reality.
Yeah, hand washing. I
Absolutely.
mean, that's a big thing that we've all heard and talked about. And again, you can give those loved ones frequent reminders to wash their hands, but that's not something that they're thinking of. So I think it's important for caregivers to do it with them. I think if our loved ones are having those cognitive issues, them seeing us washing our hands when we get back from the store is going to help them do it as well. So
absolutely, trying to explain to somebody, and we both have loved ones that have some cognitive abilities, so Kristy and I can kind of relate to this firsthand. Me trying to explain to my mom that she needs to wash her hands, keep them away from her face, and that she needs to wear a face mask and stay 6 feet away from people is about as useless as trying to explain to that banner to do the same thing. It's not that my mom doesn't want to. It's not that these folks are dead set against following these procedures. It's that they simply lack the short-term memory to remember that they need to do these tasks and the importance of them. So when you get into a living situation where you have a high number of people that have some level of cognitive impairment and don't really understand all of this, you add in some underlying medical conditions that have gotten them into a skilled nursing setting or even an assisted living setting with some help in their ADLs. The truth of the matter is, and it's important for people to understand this, folks simply don't understand that they need to do these things. So we just wanted to spend a couple of minutes today touching base on that. We know that the news, again, reports a lot of scary things, doesn't always necessarily report all of the scary things. I think that this is a situation we're going to be dealing with for a very long time moving forward. I don't mean years, I mean months. But I think it's important that folks really, truly understand not every situation is the same. Not every community is the same. And I don't care how wonderful your staff is and how much PPE and these other things you have. If you're dealing with folks that simply don't understand these things and from 1 minute to the next can't keep up, it's a recipe for disaster. And there's a lot more to it as well. Kristy and I have touched on this ourselves personally, and we'll talk about this more over the next couple of months. The things that are going on with Medicare, Medicaid, and skilled nursing and some other things in general, countrywide and in the state of New Hampshire. We've really sort of been asking for a time bomb to go off for a while, and here we are. So I think the takeaway from this is just people understanding that what you hear in the news doesn't necessarily mean that a community has done something wrong. It doesn't necessarily mean that a community is cheaping out on PPE or their training or that people don't care. It has a lot more to do with the folks that they're serving. These are literally the people that are at ground zero for issues with COVID, 60 and over, underlying medical conditions, and then you mix in the fact that these folks don't understand the requirements to prevent the spread of it. It's virtually, and I'm not going to say virtually impossible because somebody will figure it out, but we have literally talked to communities where this has started with one and then 5 days later it's everyone. There is no level of PPE that can contain something from a cognitive ability. This is similar to aging in place, and we've touched on this a couple of times before. You can design your home to age in place all you want to, but if you have cognitive issues, those sort of things, just no grab bar or Hoyer lift is ever going to fix that. So just bear in mind that these things are not always created equally. It's really, at the end of the day, the communities are doing the absolute best they can as humans to take care of other humans. There are a lot of challenges there. We do have a list of communities that have had outbreaks and do not have outbreaks. So if someone's looking to connect with a community that has a pretty good track record or has maybe already had it gone through, we'd love to help them out with that. But really, at the end of the day, the goal here is to sort of just drive home that, people with cognitive issues simply don't understand the same things that we do, and it's really difficult to control those folks.
Absolutely. And there's so many great support groups out there. So if you're looking for something for yourself, for a caregiver, whether in home or not, reach out to us and we can provide that information to you.
Absolutely.
Perfect.
Have yourself a great day.
Thank you very much.